In this video, we will learn about heart failure, the etiology of heart failure, the types of heart failure, and to learn about this topic, please stay tuned. Now, we will start heart failure topic. So, firstly, there is a definition of heart failure. What is the definition of heart failure? The pathophysiological state of impaired cardiac function, when the cardiac functions are improper, okay, and the heart is unable to maintain an adequate circulation which is needed by the body tissues, okay. So the heart is unable to maintain an adequate circulation or the metabolic needs of the body tissues. So after the definition, there is etiology. In etiology, firstly we have the the main cause of heart failure, the intrinsic pump failure, the weakening of the ventricular muscles. The ventricular muscles become weakened, and the causes are firstly ischemic heart disease, and then myocarditis, the inflammation of myocardium of the heart, and the cardiomyopathy, and metabolic disorders like beriberi, and rhythmic disorders of heart like atrial fibrillation and flutter, okay. So this was the first cause of heart failure, intrinsic pump failure, when the ventricular muscle become weak. The examples are ischemic heart disease, myocarditis, cardiomyopathy, metabolic disorders, example beriberi, and rhythmic disorders like atrial fibrillation and flutter. Second cause is increased workload on the heart, when the heart have to do more work, increasing the pressure of the load, the increased pressure load on the heart. The causes being chronic lung disease, valvular disease like stenosis, the narrowing of the vessels like mitral, and the aortic stenosis, okay. Then increasing the volume load. Firstly, there is increase in the pressure load, then increase in the volume load. The increased volume load is because of hypoxia due to lung disease and severe anemia, okay. The third etiology is impaired filling of the cardiac chambers, when the filling occur improperly of the cardiac chambers, like in the cardiac tamponade and the pericarditis, when the pericardium becomes inflamed. So this was all about etiology, okay. This includes three main causes: intrinsic pump failure, increased workload on the heart, and increased filling of the cardiac, the impaired filling of the cardiac chambers. Now we will see about the types of heart failure. Firstly, there is acute heart failure. Acute heart failure occur rapidly. Okay, the rapid reduction in cardiac output results in systemic hypotension. Systemic hypotension because of sudden reduction in the cardiac output. Okay, edema does not occur here, and cardiogenic shock and cerebral hypoxia develop, okay. Examples are larger myocardial infarction, okay, and valve rupture. Now chronic heart failure develops slowly as suggested by the name, and adjustments happens in this chronic heart failure, like compensatory mechanism develops. And the examples of chronic heart failure are myocardial ischemia from the atherosclerotic coronary artery diseases, okay, and multivalvular heart disease, chronic lung disease, which will lead to hypoxia and further pulmonary arterial hypertension. And the another cause of chronic heart failure is systemic arterial hypertension. So this is all about the etiology and the types of the heart failure. Thank you for watching.